In this video, I'm going to discuss clinical features and radiographic features of fibrous dysplasia. If fibrous dysplasia involves one bone, it is called as monoostotic fibrous dysplasia. Whereas if more than one bone is involved, it is called as polyostotic fibrous dysplasia. So monoostotic fibrous dysplasia is diagnosed during second decade of life, but it can be seen even in third or fourth year of life. The degree of bone deformity in case of monoostotic fibrous dysplasia is less severe than in polyostotic type. Commonly affected bones are ribs, femur, tibia, and craniofacial bones. There is weakness in bones, the bones are brittle, and there is loss of structural integrity. If fibrous dysplasia is seen in femur, the curvature of femoral neck and proximal shaft of femur increases, which is called as Shepherd's crook deformity. The chances of pathological fractures are more in long bones. The fibrous dysplasia of the jaw is mostly painless. There is swelling which is gradual. Very rarely, the swelling is rapid. There is equal sex predilection. The maxilla is commonly affected than mandible. The mandible is truly monoostotic variety, but if fibrous dysplasia if it is seen in maxilla, it can also involve zygoma, sphenoid, and occipital bones. The fibrous dysplasia in mandible is true monoostotic type. There is expansion of buccal and lingual plates. There is bulging of lower border of mandible. Sometimes superior displacement of inferior alveolar canal is seen, and in IOP X-rays, there is narrowing of periodontal ligament space. Coming to polyostotic fibrous dysplasia. Polyostotic fibrous dysplasia involves more than one bone. The common location is on skull, spine, or shoulder girdle. It can involve long bones also, and even ribs are affected. Polyostotic fibrous dysplasia can affect several bones of single limb. These can be unilateral or bilateral. If polyostotic fibrous dysplasia is bilateral, there is asymmetry and weakness of bones. If polyostotic fibrous dysplasia is seen along with macules and generalized pigmentation, then it is called as Jaffe's type of fibrous dysplasia. The term Albright syndrome is used when fibrous dysplasia is associated with endocrine disturbances and generalized pigmentation. The fibrous dysplasias, if associated with intramuscular myxomas, the term Meth-Brown syndrome is used. Thirdly, coming to craniofacial type of fibrous dysplasia. It occurs in 10 to 25% of patients with monoostotic type. It is seen in about 50% of patients with polyostotic type. In addition to maxilla, it also involves frontal bone, sphenoid bone, maxillary, and ethmoid bone. Clinically, there is asymmetry, there is visual impairment, there is exophthalmos, facial deformity, vestibular dysfunction, and hearing loss. So, overall, there is thickening of base of the skull, obliteration of maxillary signs, and the floor gets dislocated superiorly. Now coming to radiographic features of fibrous dysplasia. These can be unilocular or multilocular radiolucencies, or sometimes mixed radiolucent radiopaque variety is seen in the form of mottled appearance. The mottled appearance of fibrous dysplasia has fine network of fine bony trabeculae. One more feature of fibrous dysplasia is that there is merging of the lesion with adjacent normal bone. We can differentiate it fibrous dysplasia with ossifying fibroma by this feature. In radiographs also, mixed radiolucent radiopaque variety is seen. Sometimes many delicate trabeculae are superimposed in many directions, which leads to ground glass appearance of fibrous dysplasia. Under IOP X-rays, orange peel appearance is seen, and there is superior displacement of inferior alveolar canal if proper contrast is used. So to summarize, fibrous dysplasias can be radiolucent, radioopaque, or mixed variety. The smooth and homogeneous surface with endosteal scalloping and cortical thinning is seen in long bones, and the cortex is usually intact but thin due to expansile nature of the lesion. Other features include ground glass matrix, there is absence of periosteal reaction, there is rind sign. Thank you.